Hi there, my name is John Lamont. I'm a Medicare specialist with the Central Ohio Area Agency on Aging. And today I'm going to go through a presentation we prepared for folks who are coming up on entitlement to Medicare in the near future. So hopefully by the end of this, you'll know a lot more, maybe more than you ever wanted to know, about how the Medicare program works. Basically, there are 4 parts to Medicare that we'll be talking about, or 4 different programs within the Medicare program. Part A, generally for almost everybody, has no premium and basically covers inpatient hospital care. The Part B of Medicare does have a monthly premium. The Part C of Medicare is essentially Medicare managed care plans, which combines Part A and Part B. And then Part D of Medicare, which provides prescription drug coverage for folks. So I'll be talking about each of these in turn, plus a couple of other little variations to Medicare. So original Medicare is a federal health insurance program that is administered by a federal agency, the Centers for Medicare and Medicaid Services. And the program is available to anyone who is 65 years old and older, anyone who's receiving Social Security disability benefits at any age, and anyone who's been diagnosed with end-stage renal failure to the point that they're either on dialysis or scheduled for a transplant. Original Medicare, which has been around since 1965, has 2 parts. Part A is hospital. It covers hospital expenses. But you do need to be an inpatient person in a hospital. So it also pays in some instances for skilled nursing facility care, home health care, hospice care. It does not cover the expenses for doctors that would see you in the hospital or outside the hospital. And there is a significant deductible if you're admitted to the hospital under the Part A program. Part B of Medicare does provide for quite a number of outpatient services. It pays for doctors that you see in or out of the hospital and other medical providers that you might see when you're not hospitalized. It provides a host of preventive benefits, pays for durable medical equipment such as wheelchairs, walkers, and such. It does pay if you're in the hospital for observation, which essentially what that means is sometimes folks will go to the hospital, they've been told they have a serious condition, but not serious enough that they would admit you to the hospital, but you can actually be in the hospital for a period of days and even in a hospital room. But in that case, they have you in an observation status. That would be covered under Part B of Medicare. It also does not pay for prescription drugs. Original Medicare, one of its big advantages is that you're able to go to any medical provider who accepts Medicare for payment. There are no network restrictions, covers all 50 states, and so you're covered if you're traveling anywhere in the United States. But it does not provide services outside the United States. Now, the costs you're going to incur with these original parts of Medicare, as I said, very few folks pay a premium for having Part A because it's essentially paid for by part of the Social Security taxes that are deducted from folks' checks when they are working. It does have a deductible if you go into the hospital. It's $1,408, which covers the first 60 days that you're in the hospital. After that first 60 days, then you could have daily copays of $352 a day for the next 30. And if you're in there for longer than 90 days, then you have a limited number of reserve days, but your copay on those days would be $704. It does have copays if you go into a skilled nursing facility from a hospital. The first 20 days, there's no daily charge, and then for the next 80 days, you would have a $176 copay for those days. Part B of Medicare does have a monthly premium. The standard premium for Part B is $144.60, and I say the standard premium because some folks who have significantly high incomes may pay a higher premium. Part B of Medicare is not supported in any way by the Social Security taxes that are deducted from folks when they are working. And Medicare Part B also has can have penalties for folks who do not enroll timely when they first become eligible for Medicare at age 65, and that can cause them to incur a 10% permanent penalty increase in their premium for every year that they would delay enrolling in Medicare. Medicare Part B has a modest deductible, calendar year deductible of $198, and after that, generally all the services that they would get through Medicare for physicians and such would have a 20% copay according to Medicare's scheduled payments. Now, I noted that some folks will pay a higher premium for their Part B services. The income that would determine if they pay a higher premium is not the income for the current year, but from 2 years prior. And I'm not going to spend a lot of time talking about this. If you wanted to have more detailed information about this, you can go to Social Security's website, and you would look for, they have a little booklet called Medicare Premium Rules for Higher Income Beneficiaries that you can download. But essentially, the folks who are going to pay a higher Part B premium are folks who have income that are above the levels that you see on this chart. For an individual person, someone who's filing an individual tax return, in order for them to pay a higher Part B premium, they would have to have income above $87,000. For a married couple who are filing a joint return, that figure goes to above $174,000. And then for those folks, their Part B premium, instead of being $144.60, would be $202.40, and that's an individual premium. As you can see, as the income goes even higher, the premium gets higher and higher and higher, till for someone who made more than $500,000 as an individual, their Medicare premium would be $491.60. Now, for folks who are living together, or at least have lived together for part of the year and are married, if they choose to file separately, then their premium can very quickly go from the standard $144.60 to as high as $491, as you can see on that chart. Now, as far as applying for Medicare, you apply for Medicare with the Social Security Administration. You don't apply with Medicare itself. That's for Parts A and Part B. However, if you're already receiving Social Security benefits because you took it earlier than your 65th birthday, or if you're receiving railroad retirement benefits before age 65, then your enrollment is going to be automatic. You don't need to contact Social Security nor the Railroad Retirement Board, because they know from their records that you're going to be age 65 and are eligible for Medicare. Now, note that there is a specific time frame during which you may file for Medicare. It is a 7-month period beginning 3 months before the month you will be age 65 and ending in the 3rd month after your birthday month. This period is called the initial enrollment period. While Medicare Part A will begin with the month of your 65th birthday, even if you file as many as 6 months after your 65th birthday, Medicare Part B entitlement can be delayed as many as 6 months after your birthday month, depending upon when you file for Medicare. If you wish to have Medicare Part B beginning with the month of your 65th birthday, you should contact Social Security during the 3-month period before the month of your birthday. If you delay filing until your birthday month or later, Part B enrollment will be delayed up to 3 months after the month you file. If you make an appointment to file, however, Social Security will consider that date as your filing date, and Medicare enrollment will not be delayed even though your application is actually completed and submitted at a later date. And that applies to Part B of Medicare. Now, there are some folks who may not wish to enroll in Medicare, or at least Medicare Part B, during that initial enrollment period. And that would be folks who have employer group health coverage through active employment. Because in those cases, then Social Security waives the requirement that you file during that initial enrollment period, and you, without any delay or any penalties incurring at a later date, you can delay your enrollment in Part B of Medicare, save that monthly premium, because your employer group health coverage would be primary in any event. Now, if you have medical insurance from someplace that is not an employer group health coverage, then you probably would want to sign up for Part B. And also, if your employer group health coverage is going to end during that 7-month initial enrollment period, you also would not want to delay signing up for Part B because you don't get the special extension periods to enroll in Part B. To apply for Medicare, you would apply with the Social Security Administration, as I said. You can do that by calling their 1-800 number to make an appointment. You can make an appointment at any Social Security office. You can do appointments by phone, or you can do appointments in person. It's kind of up to you how you want to do that. That toll-free number is answered from 7 a.m. to 7 p.m. Monday through Friday, excluding federal holidays. You can also file online for Medicare in most cases at Social Security's website, www.ssa.gov. You can also visit a Social Security office without an appointment. Now, I only put that it's not recommended because the Social Security offices, especially in urban areas such as Columbus, get a lot of foot traffic, and so sometimes you might go in to the office and have to wait a really long time to talk to a claims representative, and sometimes they might end up making an appointment for you anyway, depending what their staffing is. So I strongly do urge that folks either make an appointment or file online. And a lot of people do file online. The application for Medicare only benefits takes about 5 or 10 minutes to complete on Social Security's website. Now, in applying for Medicare Part A, there is no premium that you're going to pay for the Part A hospital coverage if you have at least 40 credits in the Social Security system, which would also mean that you're going to be eligible for a Social Security benefit. There's also no premium for the Part A services for folks who are eligible already for a Social Security cash benefit, so this would, or would be eligible for one. So this would be folks such as spouses, divorced spouses in some instances, and surviving spouses might also be eligible for premium-free Part A coverage. There's never a penalty for delaying enrollment in Part A after age 65 if you are eligible for the Part A benefits without a premium. So you don't have to have employer health coverage or anything. And if you sign up for Part A after age 65 and you're eligible for a Social Security benefit where you have those 40 credits, your coverage is going to be effective immediately. In fact, depending upon your age, sometimes it can be even retroactive as many as 6 months earlier than the time that you file. You can apply for Part A benefits only and decline coverage in the Part B program. Now, if you're covered under your own or your spouse's current employer group health plan, you can delay enrollment in Medicare Part B with no late enrollment penalty or coverage gap. Now, it is important that you be married, because if you have coverage from an employer group health plan from someone who is not your spouse, this exclusion does not apply. Keep in mind, if you are retired, you are not an employee any longer, so you would want to sign up for Part B right away. If you have COBRA insurance, that also is not considered an employer health plan, so you also would want to sign up for Part B timely when you turn age 65. If you're covered by that employer group health plan, you can enroll in Part B at any time that your coverage continues in the future. Whenever that employment or insurance ends, you are then going to be provided with an 8-month special enrollment period, during which time you can enroll in Part B without any premium surcharges or anything. If you don't want to have any delays in coverage, you would probably want to sign up for Part B no later than the month after your health insurance ended. If you're not covered by an employer group health plan and you turn age 65, then if you delay enrolling in Part B because you maybe feel that you're healthy and you don't want to pay the premium, that could cause you higher premiums and delayed enrollment in the future when you did decide that you maybe would want to have Part B coverage. And the way that works is your premium would be permanently increased by 10% for every 12-month period that you did not have Part B enrollment and you did not have employer health coverage. Also, you would only be permitted to enroll in Medicare Part B in the months of January, February, and March, and your coverage would not begin in July. So for most folks, we strongly urge that when you turn age 65, if you do not have employer group health coverage, that you go ahead and sign up for Part B, because you never know when you might have a major illness at some point in the future. An employer group health plan If you have that, Medicare is usually going to be the secondary payer to the insurance provided by that employer. So again, if you were to sign up for Medicare Part A or Part B and you had an employer health plan coverage, then the Medicare is going to be secondary so it's only going to pay anything that your health insurance from your employer did not pay. Okay, now if you do have an employer group health plan, there is one caution. If your employer group health plan is from an employer that has fewer than 20 employees, if you're 65 years old or older, or fewer than 100 employees for an individual who's under the age of 65, then you may want to go ahead and sign up for Medicare Part B, because in those instances, employer insurance can reduce the benefits that they provide if you do not have Medicare entitlement. So that's something you'd want to check with your employer or with the employer's insurance. Now, if you've been waiting expectantly to turn age 65 so that you have Medicare to have that dental work and vision and hearing benefits, I have bad news. Medicare, original Medicare in any event, has no dental, vision, or hearing coverage. It's basically just for medical procedures and prescriptions only, so it does not provide for unskilled nursing care like if you're in a nursing home. It doesn't provide for eyeglasses, hearing aids, routine and recurring dental and vision services and things like that, crowns, whatever. Now, Medicare does have quite a number of preventive benefits that it provides for. It provides for screening tests and procedures, and a lot of these have no out-of-pocket costs. Some examples could be vaccines for the flu, pneumonia, hepatitis B. Folks are also eligible for a Welcome to Medicare and annual wellness check when they first become eligible, and then later on with Medicare, and it pays for diabetes testing supplies. If you're interested in finding out precisely what Medicare does cover, if you go to Medicare's website, medicare.gov, on the home page, you'll see at the top a blue button where it says what Medicare covers. Click that and it'll take you to a page where it gives a lot of information on the types of coverage that you get. Now, for folks who also have coverage under the Veterans VA healthcare system, some folks even choose to just keep that, not have Medicare, but one thing that we would caution you is that Medicare and the VA healthcare system do not coordinate benefits or co-pays. So if you go to a Medicare provider, the VA is generally not going to pay the Medicare co-pays that you have. Vice versa, if you go to a VA hospital, Medicare is not going to pay your co-pays there either, unless you're going through the program that the VA has, where sometimes they will refer you out to a doctor or medical provider outside their system. Now, TRICARE, which is for military retirees, also requires enrollment in both Medicare A and B. And if you do not enroll in both of those, then you could have a loss of benefits under your TRICARE program. For folks who may have a health savings account with their employer insurance, if they enroll in Medicare A or B, then the Internal Revenue Service no longer permits them to make tax-deductible contributions to their health savings account. The monies that they might already have in a health savings account, HSA, can still be used to pay for medical expenses, Medicare Part B premium, long-term care insurance premiums, etc. And if you want more addition about how Medicare and health savings accounts work, you can go to IRS's website, irs.gov, look for IRS Publication 969, and it gives information in there. Now, for folks who have retired from government agencies, OPERS, which is the Public Employees Retirement System for many of the government employees here in Ohio, that retirement system requires all of its members to enroll in both Parts A and Part B once they are retired in age 65. All of the other Ohio public employee retirement systems require their members to enroll in Part B once they become entitled to retirement benefits and are age 65. They primarily do this because it saves those health systems, their health systems, those retirement systems, a lot of money if the federal government's Medicare program is paying claims instead of their systems. For federal government retirees who have insurance under the FEHB, Federal Employee Health Benefits Program, that program does not require their folks to enroll in either Part A or Part B, but many folks still do. If you're enrolled in Medicare, federal retirees, FEHB plans are going to act as a Medicare supplement insurance plan and pay many of the co-pays and deductibles that you would have with Medicare, because Medicare would be the primary payer. Okay, so that's a review of original Medicare. Now, you can just have original Medicare, which is going to pay for your medical expenses. However, as we said, original Medicare does have a lot of co-pays and deductibles. So some folks prefer to have insurance that might help them pay those co-pays and those deductibles. And also, original Medicare does not provide for prescription drug coverage, so you would need to purchase prescription drug coverage. And there's basically two ways you can deal with those questions. One is you could purchase secondary insurance and or prescription drug coverage, or you could purchase what's called a Medicare Advantage plan. So next we're going to talk about secondary insurance and how it works. Then I'm going to talk about prescription drug coverage, and then we'll pivot over and talk about Medicare Advantage plans. Now, secondary medical insurance basically can be group health insurance that you have from a former employer or a union that would supplement Medicare and pay in whole or in part the premium or the co-pays that you have with Medicare. It could also be Medicaid or Medicare savings programs, assistance that you get through government agencies. These typically are just available to folks who have limited income and limited resources. And then finally, you could have what's called Medicare supplemental insurance. This is private insurance plans that coordinates with the original Medicare program, paying in whole or in part the co-pays and deductibles with original Medicare. This is also referred to often as Medigap policies or MedSup policies. So the characteristics of Medicare supplement insurance is that it's private insurance. You are going to pay a premium for it. It's not free. You must have both Part A and Part B of original Medicare to have Medicare supplement insurance. You're going to have little or no out-of-pocket cost other than your premium if you have most Medicare supplement insurance plans, because they're going to pay most of your co-pays and most of the deductibles, or at least a lion's share of it, from Part A and Part B. You're not going to have any networks for doctors or hospitals because your primary insurance is going to be Medicare. So, and as I said, with original Medicare, you can go to any doctor, any hospital, anywhere in the United States, so long as they accept Medicare for payment. Now, some of these plans also provide limited coverage outside the United States if you're traveling for a limited period of time. Now, these Medicare supplement insurance plans do not have any annual open enrollment period, so as a general rule, when you first become eligible for Medicare, you're going to have a period of time that you can enroll without restrictions as far as your medical condition. And these plans do not provide prescription drug coverage. That's yet another part of Medicare. Now, if you're purchasing a Medicare supplement insurance plan, depending upon your age, you're going to have 8 to 10 different plan models to choose from. These plan models are identified by letter, and the letters A and B have nothing to do with original Medicare. But basically, if you were looking to purchase one of those, you would want to decide which plan model that you prefer. All the plans of the same letter have identical coverage. So, but there might be many companies that sell the same coverage. For instance, Plan F. There might be 50 companies here in Ohio that sell medical supplement insurance Plan F, but they're all selling exactly the same thing, exactly the same coverage, no different. Same with G, K, and so forth. But the one thing that can vary greatly between companies is the premiums that they charge. For instance, with the Plan F, the least expensive Plan F coverage plan that's available right now in Ohio is a little bit more than $100 a month premium. But there's other Plan Fs that other companies have that can go as high as $300 a month. Same thing, the very same coverage. And all of these plans, their premiums are going to increase as you age. Generally, every year in your birthday month, you're going to have an increase in the premium. So when you purchase these plans, for instance, at age 65, that doesn't mean your premium is going to stay the same as you get older. So when you purchase one of these plans, you would want to compare these plans on their price, their initial price. You'd want to compare them on the benefits provided. And then you also would want to look at how quickly the premiums are going to increase as you age. All of the plans that are out there, when you look at these, it would have a schedule within the plan that shows you how quickly the premiums are going to increase as you age. Now keep in mind, just as with every other kind of insurance, the insurance companies can petition the Ohio Department of Insurance for premium increases depending upon their claims experience. The Ohio Department of Insurance's Medicare section, OSHIP, or our agency, the Central Ohio Area Agency on Aging, can provide pricing schedules that would show you the plans ranked from lowest to highest premium costs for the different models. But if you wanted one of these Medicare supplement insurance plans, you would sign up with the insurance company, not through Social Security, not through Medicare. So you would contact the private insurance company just like you do for house insurance, car insurance, and so forth. This is just an example pulled from one company's actual premium schedule book that shows how the premiums increase as someone ages with the different plans. So as you can see, if you're looking at Plan F, for someone age 65, this particular plan would start out them paying a little bit more than $155 a month. But 10 years later, they'd be age 75. Now their premium would have increased to $227 a month, and so forth. So a schedule similar to this is going to be within the documentation that you would receive, or you would look at if you're trying to decide which plan you wanted to purchase. Now the thing with Medicare supplement insurance is you have what is referred to as a guaranteed issue period, during which time you can purchase these plans and have no medical underwriting questions asked, no evaluation. The companies basically have to sell you the policy if you want to buy it. This guaranteed issue period is the first 6 months that you are age 65 or older and that you're also enrolled in Part B. There also can be some special circumstances that can provide you another guaranteed issue period if you have health coverage that ends through no fault of your own, or if you have an Advantage plan and they're leaving the Medicare program. So I just want to mention that because if something untoward does happen, there are means by which you can get a new supplement insurance plan. And then also there's something called a trial right guaranteed issue period. And this would apply if somebody had purchased a Medicare supplement insurance plan when they were first eligible for Medicare, later decided to join a Medicare Advantage plan, and then didn't like the Advantage plan and then wanted to go back to a Medicare supplement plan with a year, then they get a new guaranteed issue period to purchase a new Medicare supplement insurance plan. So when you're choosing a Medicare supplement insurance plan, the first thing you would want to do is look at the different types of plans, those A, B, C, D plans. Look at what the difference is, decide which plan's coverage level works best for you. We always suggest that you might want to look at least 3 different companies' plans, maybe more depending upon how much time you have. Look at what their initial premium is, but also look at how quickly their premium is going to increase in the future, because the rate of percentage increase can differ significantly from one company, from one plan to another. Some plans have an average premium increase rate of maybe 1.5%. Others have 3 or even 4%. So you'd want to look at that. Keep in mind you have to be able to afford it now. You also want to be able to afford it 5 or 10 years from now. Next, we're going to talk about Medicare's prescription drug plan, Part D. Medicare's prescription drug coverage is also coverage that is offered by private insurance companies that contract with Medicare, and their plans are evaluated and approved by Medicare. There's 2 different ways you can get Medicare prescription drug coverage. One is through what's called a standalone prescription drug plan, which basically only provides prescription drug coverage, and then you can get prescription drug coverage through a Medicare Advantage plan, which is the last thing we're going to talk about. Just as with Medicare Part B, there can be penalties and restricted enrollment periods that could apply if you do not enroll in a Part D prescription drug plan timely when you reach age 65. Here in Central Ohio this year, there's over 20 prescription drug plans available and more than 35 Advantage plans that include prescription drug coverage as part of the Advantage plan. Now, there is one exception that does apply to someone who might not want to purchase a Medicare prescription drug coverage when they turn age 65. If you have other prescription drug coverage from any source, it could be from an employer, it could be from a union plan or whatever. If that coverage is considered creditable coverage by Medicare, then there's no requirement that you purchase a Medicare prescription drug plan, and there won't be any penalties or delays in the future if you sign up for a Medicare prescription drug plan. Because basically Medicare knows that you have prescription drug coverage that's equal to or better than their own coverage. They call that credible coverage, and so there's no requirement that you sign up for a Medicare prescription drug plan. So that could be employer insurance, retiree insurance, COBRA insurance, veterans health care, etc. As far as applying for Medicare Part D goes, at age 65, you again have that 7-month initial enrollment period that we referred to earlier for Part B coverage. It's the same for Medicare prescription drug coverage. If you decline to enroll at age 65 because you had credible drug coverage, then you can enroll in a drug plan at any time so long as you have that credible coverage. So if 2 years or 10 years later, if you've had creditable drug coverage from another source, you can switch to Medicare prescription drug coverage at any time if you wish to do so. If your other drug coverage or other creditable drug coverage ends, then so long as you enroll in a Part D plan within 62 days of that coverage ending, you're not going to have any penalties or coverage gaps in prescription drug coverage. There can be some other special circumstances or changes that can also provide a special enrollment period to enroll in a Medicare prescription drug plan. Anyone who has Medicare A coverage or B coverage or both can enroll in a Medicare prescription drug plan. But keep in mind, you might not need it if you have credible coverage. You can enroll in a Medicare prescription drug plan directly with the insurance company, or you can enroll with Medicare at Medicare.gov's website. Every year for folks who have Medicare prescription drug coverage already, there's what's referred to as an open enrollment period, during which time you can change from one plan to another plan, during which time folks who were not previously enrolled in a Medicare prescription drug plan can enroll in one of the plans. If you're changing or initially enrolling, then your coverage is going to start on January 1st. This open enrollment period is the same every year, October 15th through December the 7th. It is strongly recommended by our agency and also the Department of Insurance that you review your plans annually, because sometimes prescription drug coverage can change. The companies can change the prices or the drugs they cover and so forth. And there is a program on Medicare's website that can help you determine which plan is most beneficial and economical for you. So the average monthly premium for a Medicare drug plan is about $35 a month, but the plan premiums can range from a low of $13.20 a month to over $80 a month. Depending upon the drugs you may be taking, you might have a higher plan cost. Start that over. I'm going to start it all over.
That's fine.
So the average monthly premium for a Medicare drug plan is $35 a month, but plan premiums do range from a low of $13.20 a month to over $80 a month. Depending upon the drugs you may be taking, higher cost plans may actually be less expensive for you when considering your total annual drug cost. Plan deductibles may range from $0 to $435 depending upon the plan, but some drugs, especially low-cost generic drugs, might not even be subject to the deductible either in some of the plans. So keep in mind that cost of a drug may differ greatly from one plan to another. Also note that the plans must provide coverage for at least 2 drugs in every class of drugs. but they do not have to cover all drugs. So different plans will have different drugs in their formularies. Cost of a drug may also change during the year as your total drug cost increased. Plans may also differ as to requirements for step therapy, wherein you are required to use lower cost drugs first, or with requirements for pre-authorization for use and coverage of a drug. Finally, if you want more information on how the drug programs work, you can go to Medicare's website, where on the home page there is a tab that will direct you to a section where a great deal of information is provided regarding drug plans and drug coverage. When you sign up for a Medicare prescription drug plan, they have what's called an initial coverage limit, which basically means that the plan may set prices for the drugs that it covers, and until you and the plan together have spent a little over $4,000 on covered drugs, the plans have a lot of discretion in setting the cost of drugs. So you might have significant differences in drug cost during that period of time, because the cost of drugs might be a set percentage or a flat copay that's noted in the plan's formulary. But the cost can vary significantly from plan to plan. Then you might come into what they call the coverage gap limit, also referred to as the donut hole. Once you and the plan combined have spent $4,020 on covered drugs, then you're assured that your cost for a drug is not going to exceed 25% of the plan's cost for that drug. But some plans will offer copays lower than 25% in this gap. So the coverage you get from different plans may differ when you're in this donut hole period. And the cost, again, can vary among the different plans. And then, if you have a lot of drug cost, once your out-of-pocket cost equals $6,350, then you're no longer in that coverage gap period, the donut hole. Now you're in what they call the catastrophic coverage level. And generally, if you have spent this much, then the plans are going to assure that you're only going to pay a small co-insurance amount or co-payment for drugs covered for the rest of the year, generally not exceeding a 5% copay for that drug. The premium that you're going to pay for the various drug plans also can be higher if you have higher income, just as it is with Part B. Again, the income breaks are pretty much the same, and you can see how much your premium is going to increase as your income goes higher. So, in summation, the things you want to consider if you're purchasing a Medicare prescription drug plan, this is kind of a recap. Plans have different cost structures. They have different formularies. Plans don't cover all drugs. Plans do not all cover the same drugs. Plans can have different preferred pharmacy networks, and you might pay different costs for the same drug depending upon which pharmacy you go to, if it's an out-of-network pharmacy. Plans can charge different prices for the very same drugs. Your cost is going to be based upon your own individual drug needs. So even if you have a friend or a spouse telling you that, oh, I love my drug plan coverage, keep in mind that depending upon the drugs that you're taking, another plan might be a better fit for you. Also keep in mind that plan coverages can change from year to year. They can add or subtract drugs, change their prices from drugs. So it's a very good idea to look at your coverage every year annually during the fall open enrollment period. And keep in mind, if you're thinking of not taking Part D coverage when you turn age 65, maybe you don't take any drugs at all. Just keep in mind that if you don't have creditable coverage, that you can incur a 1% premium increase for every month that you delay enrolling in a Medicare prescription drug plan, that increased premium can very quickly equal any savings you're going to get. So even if you don't take any drugs at all when you're 65, but 4 years later, 5 years later, suddenly now you would end up needing a lot of expensive drugs. You can't just sign up for a Medicare prescription drug plan anytime you want. You can only sign up during that open enrollment period. And your premium, if you waited 5 years, is going to be 50% more. Late enrollees can only enroll during that fall open enrollment period. So that brings us to the Medicare Advantage plans. These are the plans that you often see advertised quite a lot. Basically what these Medicare Advantage plans do is combine the coverage that you would be receiving under Medicare A and B, and in most cases also the Medicare prescription drug plan. Medicare Advantage plans are available to anyone who is enrolled in both Parts A and Part B of Original Medicare. You must live within the plan's service area, so different areas of the state would offer different plans to different people. Generally here in Columbus, the plans that would be offered would cover folks in Franklin County and possibly county that touches Franklin. It all depends. You'd have to check. There are no age or medical restrictions, so that you're never going to be asked about what your past health history has been. There's no pre-existing medical condition restrictions with the exception of end-stage renal failure. You're still going to pay your Part B premium to Medicare, and there's two basic versions of Medicare Advantage plans that are offered. One of them is the HMO or Health Maintenance Organization type structure, and the other is the PPO, Preferred Provider Organization. And basically what the HMO structure is you might have a very tight network of doctors in hospitals and other providers you have to go to, whereas with the PPO model, you almost certainly will have a preferred network, but you are permitted to go out of network, although probably at a higher cost. Most plans are going to include the prescription drug benefit. All of the plans are going to have deductibles and copays for most of the services that you get with these plans, and their copays and their deductibles can be different than what they are under the Medicare Part A and Part B plans. Your networks, your premiums, and your copays are going to differ from plan to plan. As far as enrolling in a Medicare Advantage plan, again, if you're new to Medicare, you can enroll during that initial 7-month period when you turn age 65 if you're enrolling in Medicare Parts A and B. Every year you can enroll in a new plan from October the 15th to December the 7th. You can change your coverage from one Advantage plan to another. If you've had it, your new coverage wouldn't start until January 1. If you've already had an Advantage plan, you can also switch to a different Advantage plan during the first 3 months of the year, January 1st through March 31st. How do the Advantage plans work? Well, if you have coverage through a Medicare Advantage plan, you would keep your red, white, and blue Medicare card, but you no longer would submit your medical claims to Medicare because your coverage would now be provided by the insurance company that you have enrolled in their Advantage plan. The charges are going to be submitted to that plan, not to Medicare. The plan that you select will very likely have a designated preferred medical network where you're going to get the best set of prices. Some plans you can basically only use their medical network and have the plan pay the cost for it. Others will let you go out of network but at a higher cost. The plan might not cover or might charge higher copays for non-network providers. Many of these plans have no premium as Medicare pays a fixed amount monthly to every insurer to cover the cost for the beneficiaries that they serve. But some plans do have premiums. Some plans might require that you obtain referral to a specialist from your general practitioner. Some plans might have coverage for vision, dental, or other services that are not covered by Original Medicare. And some of them might charge an additional premium for that type of service. But again, these plans typically are going to have copays or deductibles for just about all the services that they have, and these plans do not coordinate with Medicare supplement insurance plans. So if you have a Medicare supplement insurance plan and you decide to go with an Advantage plan, you would not want to keep that Medicare supplement insurance plan and pay that premium because you wouldn't be getting any coverage from it. If you're choosing a Medicare Advantage plan, you'd want to look at its prescription drug coverage because just as with the standalone drug plans, the companies may charge vastly different prices for different drugs or not cover all drugs. You would want to look at what medical providers are in that plan's network. Are your preferred medical providers in that network? What I always tell folks if they're looking at an Advantage plan, the first call they would want to make is to any doctor or doctors that they want to continue seeing to find out what Medicare plans that medical practice works with. If it's important to you to use out-of-network medical providers, then you would probably want to look at a plan that is a preferred provider model that does let you go out-of-network. Although, again, you might have higher deductibles, copays, and so forth. And then some folks like to look at benefits that original Medicare does not provide, such as vision benefits, dental benefits, silver sneakers, and they have a lot of other small little benefits that are out there. So you might want to look at that once you've kind of narrowed it down to which plans you're thinking about. Now, as far as changing from one type of coverage to another, if you're currently covered or if you purchase a Medicare supplement insurance plan and you want to go to a Medicare Advantage plan, you can do that any year during the open enrollment period from October to December. If you want to go from one Medicare supplement plan to another Medicare supplement plan, just keep in mind you have that initial guaranteed issue period when you're first eligible for both Medicare Part A and Part B. After that 6-month guaranteed issue period, you can always apply for coverage with any Medicare supplement insurance plan company, but they are free to ask you medical questions. They can deny you coverage if they don't like the information they get from you, or they can also charge you higher premiums than their standard premium. There are no annual open enrollment periods in Ohio for Medicare supplement insurance plan. If you want to go from one Medicare Advantage plan to another, you can do that every year during the open enrollment period or in the months of January to March. And if you want to go from a Medicare Advantage plan to a supplement, again, it's not a guaranteed issue period unless you're in a special enrollment period. Okay, so this at-a-glance slide is basically just a restatement, a summation of the information that I've spoken about thus far, which is why would you choose, or why do people choose a supplement plan over an Advantage plan or so forth. Primary consideration for many people is cost. If you pick a Medicare supplement insurance plan, as I've said earlier, you are going to have a monthly premium, generally in the $100 or so range, which gets higher as you get older, that you're going to have to pay for it. But basically you're paying ahead of time because you're going to have little or no out-of-pocket cost when and if you need to use medical services. Medicare Advantage plan, on the other hand, oftentimes they have no premium or a lower premium you're going to have with a Medicare supplement insurance plan, but you are going to have out-of-pocket costs for many, many, many of the services when and if you do need to have medical issues dealt with later. Provider choice, since you still have traditional Medicare, original Medicare, when you have a Medicare supplement, you can use any provider anywhere in the United States. If you have a medical issue, you also would for sure have foreign travel emergency coverage with some of the Medicare supplement insurance plans. And that's a very important consideration for a lot of folks. Medicare Advantage plans, at minimum, these plans would have a preferred provider network. Some of the plans you can only use medical treating sources within their preferred provider network. Some of them do allow you to go outside the network, but you're going to pay a higher cost. And with Medicare Advantage plans, you're generally going to pay deductibles for most of your services. Some of these plans also would have coverage if you're outside the United States for at least a travel period of time. So Medicare supplement plans are very important for folks who do not want to have to deal with network or be restricted in who they use, and those also are folks who can afford to pay that monthly premium that they have. People who get Medicare Advantage plans, they're okay just using the network of doctors and hospitals and such that the plan provides, and they might be attracted to the added benefits such as vision and dental that you might get there. And with drug coverage, again, you don't have that with a Medicare supplement insurance plan, so you're going to have to purchase a separate prescription drug plan. With Medicare Advantage plans, most of the time your drug coverage is going to be included. As far as researching your plans or trying to choose the difference in those, this is a screenshot of Medicare's current homepage, and I've just put some arrows at some of the places you might want to look at. One, if you want to sign up or change your plans, your Advantage plans, you can see that arrow over to the left part of the screen. You click on that button and it's going to take you to a section where it gives you a lot of information about doing that. If you want more information about Medicare supplement plans, you can see that button at the top. Again, you go there and it's going to give you a lot of information on how the plans differ, companies that sell the plans, and so forth. In the middle of the screen, it talks about logging in or create an account. If you're eligible for Medicare, then you can create a My Medicare account, which then gives you access to the medical claims history that you might have. It also allows you to put in the drugs that you take and makes it very easy to compare the different Medicare drug plans, the Medicare Advantage plans. If you're trying to find different providers who provide different services, there at the bottom there you can see where it says Find Care, and it can give you information about finding providers and facilities and so forth. If you're wondering what does Medicare cover, right next to that there's a What's Covered button, and you click that and it's going to give you information, detailed information about what covered items and services are available. If to create your own Medicare account, you would just click on this where it says Log in and Create Account. It's going to ask you a few questions, and then you'll create your own PIN and your own password. This is the page on Medicare where it helps you to find doctors and hospitals and other providers who cover different types of, who provide different types of services for you. And then there is financial assistance that's available to some Medicare beneficiaries who have limited income and limited resources. These would be called Medicare savings plans. Basically, any single person who has income under $1,426 a month or a married couple under $1,923 can be eligible for government assistance to help them pay their Medicare premiums in some cases, or co-pays, or deductibles. If you want information about how these programs work, you can contact the Ohio Medicaid hotline. You can go online to apply at benefits.ohio.gov, or you can visit your local Ohio Jobs and Family Services office. There is also assistance available for paying prescription drug costs. This is through the Social Security Administration. Depending upon your income level, you might have to pay a reduced or no premium for your drug plan, no deductibles or reduced deductibles. Your copays would be limited to no higher than 15% of the cost of the drugs. You'd get more frequent enrollment periods at times. You wouldn't have to go through the donut hole. And again, the income levels that are shown here generally would apply, but keep in mind Social Security discounts or doesn't even consider certain types of income, or they might have certain income disregards. So if you're even remotely close to these income or resource levels, it does pay to contact Social Security. If you want to apply with Social Security, you don't need to visit their office. You don't need to call them if you don't want to. You can go to their website, create the application for the extra help is what they refer to it, or prescription drug assistance. It takes about 10 or 15 minutes to do. You don't have to submit any documentation to them either. They basically do a data match with the Internal Revenue Service and several other government agencies to determine if your income and your resources are within the program limits. If you wish to have assistance in completing the low income subsidy application on Social Security's website, you may also contact us here at the Central Ohio Area Agency on Aging, and we can assist you in doing that filing or answer questions about it. So that is kind of a quick run through how Medicare works. If you have additional questions, if you want somebody to help you in the plan selection for an Advantage plan, for a prescription drug plan, if you want additional information concerning the difference in prices for Medicare supplement insurance plans, you can contact us here at the Central Ohio Area Agency on Aging. That's our toll-free number there. We're here Monday through Friday, and we can sometimes meet with you in person if necessary. You can also contact the Ohio Department of Insurance. Their OSHIP section deals only with Medicare questions. Their toll-free number is right next to that, and that is answered Monday through Friday, or you can get information on their website, insurance.ohio.gov. You can also contact Medicare itself at 1-800-MEDICARE. Their telephone number is answered 24 hours a day, 7 days a week, almost all year except for a couple federal holidays. There's also just a wealth of information on Medicare's website, medicare.gov. And of course, if you create a My Medicare account once you're eligible for Medicare. And then finally, Social Security's toll-free number, 800-772-1213, or Social Security's website. But all you would really want to contact them about is if you had questions about enrolling in Medicare or the extra help with the prescription drug costs, because Social Security is basically the gatekeeper to the Medicare program. But once you're signed up, they really don't have anything to do or any role to play as far as paying claims and so forth. So I hope you have found this information helpful. If you have any questions, please give us a call. Thank you very much.